What is the role of structured or synoptic reporting when it comes to HER2 testing in breast cancer? Pathology reports help oncologists select the right treatments. Since reports contain technical jargon, key information should be organized to ensure that oncologists can find what they need to make treatment decisions. Synoptic reporting is a structured format for reporting key data elements. Synoptic reporting can improve the completeness, accuracy, and ease of creating the report. Without the use of templated reporting structures, reports often contain a lot of free text, be highly narrative, and may omit necessary information. Historically, oncologists needed to know if HER2 results were either positive or negative in breast cancer. We now have treatments for patients with low or ultra-low levels of HER2 expression. How can pathology reports help oncologists identify these patients? Tip 1. Be sure that the pathology reports clearly indicate the IHC score, 0, 0+, 1+, 2+, and 3+. The score of 0+ was recently recommended in the March 2025 CAP biomarker reporting template. Use IHC 0+ when results show membrane staining that is incomplete and is faint, barely perceptible, and in less than or equal to 10% of tumor cells. Tip 2. Consider whether your pathology reports should include terms like HER2 low and HER2 ultra low. Tip 3. The CAP biomarker reporting template also includes the suggested comment. In the Destiny Breast 04 and 06 trials, HER2 low was considered IHC score 1 plus or 2 plus, ISH negative, and HER2 ultra low was HER2 IHC score of 0, pattern 0 plus, with membrane staining that is incomplete and faint, barely perceptible in less than or equal to 10% of tumor cells. Breast cancers with these staining patterns may be eligible for treatment with trastuzumab deruxtecan in the metastatic setting, but those with no staining, IHC 0, are currently excluded. Remember that many oncologists may not read the entire pathology report. They may be scanning for the crucial pieces of information that will guide their treatment decisions. Tip 4. Pathologists and oncologists should work together to update reporting templates and ensure terminology is aligned so that everyone understands what the results mean. Because when HER2 is reported clearly, oncologists can easily identify which patients may be eligible for certain targeted treatments. Learn more about HER2 low and HER2 ultra low breast cancer by visiting the ASCP website, where you will find continuing education activities on this topic. This resource is supported by independent educational grants from AstraZeneca Pharmaceuticals and Daiichi Sankyo, Inc.